Hello, my name is Cullen Sharkey, and I will be presenting with my group the Stand Tall program, which is a wellness program for individuals with spinal cord injuries. My group is Yildiz Claiborne, myself, Michelle Nguyen, Seth Stafford, Anna Ahern, and Emily Rice. So the problem that we found with our group is that we have clients with spinal cord injuries who are no longer able to participate in previous hobbies or activities due to inaccessibility and lack of support. Through the Stand Tall program, we will be providing support, education, and accessible outdoor activities in order to help clients with spinal cord injuries participate in life as well as socialize with others with similar conditions.
Hello, my name is Seth Stafford, and I'm going to be talking with you guys about statistics. So looking at statistics itself, we had to kind of have some background information on why we chose this population. We chose the spinal cord injury population because the incident rate is about 26.5 cases per 1 million inhabitants. So looking here at the United States, we are actually seeing about 17,000 new cases of spinal cord injuries every year within the United States. Out of those cases and the total number of spinal cord injury patients, 78.3% of those individuals are male, and they're around the average age of 51 and a half. And most of these individuals, about 52.1% of spinal cord injuries, deal with up in the cervical spine or within the neck. So that tells us when we're designing our program that we need to make adaptive equipment for people with may not have full functional use of their arms and their legs. Looking at the barriers themselves, we first initially started talking about distance to healthcare. So in numerous studies, it was noted that if a patient that had a spinal cord injury lived too far away from specialized healthcare, they may opt out in receiving that specialized healthcare and receiving items that may be lesser in their treatment or getting less quality of care. This was looped into transportation because depending on where the individual lives, they may not have adequate transportation to transport them and their assistive device, or if they're using a wheelchair, to that specialized care, or it may cost too much money to move them. That goes into the idea of the financial status with this individual, and after having a traumatic spinal cord injury, the individuals themselves noted a hard financial burden on themselves and on the family. So here now we're not only worrying about paying for medical bills, but also paying for a family to survive and paying for adaptive equipment, which can cause a huge amount of strain on the individual. Lastly, we have access to equipment and public spaces. Here, most of the equipment that these individuals need is very expensive, and it may be difficult for insurance companies to pay for certain equipment that is not medically necessary. So different variations of adaptive equipment that we'll see later in our program that helps individuals to participate in recreational programs may not be covered by insurance, which may limit their options of what they can do. Additionally, with public spaces, we know that certain buildings may not be up to code within the United States that has accessibility with ramps or areas for wheelchairs to get into to move up to various parts of the building, like an elevator. So with that being said, this patient population, or this population in general, is going to be limited on where they can go, which can cause a barrier on their social environment. And more importantly, their social support that they've been with for years is now being altered if they have to move away for specialized care. So all of this coming into play, that our organization is targeting various dimensions of wellness, and we want to improve not only their physical capabilities, but also improve areas of emotional, social, and financial.
My name is Yildiz Claiborne. The Stand Tall program is a series of health and wellness events designed to empower and support individuals with SCI. We strive to reduce barriers to care access for individuals with SCI by providing wellness services at no cost and transportation to our wellness events, providing free and enjoyable services that promote physical activity, social support, and finance education. We strive to improve quality and quantity of life by enhancing physical fitness, leading to improved overall health and well-being.
My name is Emily Rice, and I'll be going over the Healthy People 2020. Our nonprofit program will address all four goals of Healthy People 2020 by providing our participants with various adapted physical activities, social support services, while also reducing financial burden through our free services. Health inequality is evidenced by the growing prevalence of unmet healthcare needs among individuals within the spinal cord injury population due to the complexity of the condition, barriers, and lack of efficacy within the healthcare system. Due to these complexities, including chronic illness, comorbidities, impairments, this population is heavily dependent on the healthcare system and various services such as specialized and community care. The main barriers that challenge access to quality care in the spinal cord injury population include affordability, transportation, and service availability. The standing program we have created aims to create healthy opportunities and environmental advantages to prevent these medical conditions and improve quality of life. Our program also addresses these barriers by creating services to promote physical activity, social support, and financial education, creating equal health opportunities within the spinal cord injury community.
My name is Josie Deal, and I'll be addressing the different components of wellness. When considering the domains of wellness, our program specifically targets these three components: social, financial, and physical. Our program will provide a space for men with various levels of spinal cord injuries to participate in a planned physical activity and a social debrief to follow. We chose to focus on these three components to best serve the community and their current needs. Qualitative studies have proven that social support is a major contributor to successful reintegration into society after a spinal cord injury, especially in combination with emotional support provided by family, peers, and friends. The social component of wellness will be addressed through the debrief sessions, allowing our participants time to reflect, relate, and share their experiences and stories. Our program will also open our doors to the caregivers and friends of participants in hopes that the combination of family and peer social support will help generate a better quality of life. During the social hour, guest speakers from the community will be brought in to discuss various topics related to patients post-spinal cord injury, including nutrition, advocacy, finances, assistive technology, stress and pain management, and mental health. This will provide our participants with resources and education that will allow them to be better reintegrated into society, along with understanding their bodies, impairments, and how to move forward in life after spinal cord injury. Within the spinal cord injury population, finances can become a major hardship. Our aim in providing this program is to better allow for financial literacy while also giving the participants an opportunity to develop new skills based on their specific disability without added financial stress. The grant-funded equipment is provided free to the participants to allow for greater accessibility overall. All services provided by the community members will be volunteer-based and free of charge. Additionally, one of the guest speakers will be educating on financial relief within their community and how to be successful financially post-spinal cord injury. Finally, our program will address the physical domains of wellness. Because life after spinal cord injury can be tough to navigate, our program wants to allow for curiosity and the acquisition of new skills in a safe environment. Providing them with the opportunity to explore adaptive equipment and management of modified skills will lead to a greater sense of autonomy and keeping them engaged in life after spinal cord injury. A sedentary lifestyle puts the spinal cord injury population at greater risk of developing secondary conditions, including cardiovascular disease, changes in metabolic and body composition. Our program will help them maintain an active lifestyle along with resources, including a registered dietitian and physical therapist, to further encourage a well-balanced and healthy lifestyle.
Hi, my name is Emily Rice, and I'll be going over the cultural domains. As unfortunate as it may be, criticisms from society are likely for this population. Society may view the spinal cord injury population as incapable and too disabled to participate in activities that require physical mobility. This perception may then lead to avoidance of activities and tasks that an individual with a spinal cord injury may enjoy, and overall creating a negative mindset and outlook on themselves, creating further issues. The disability attitude is an idea that caregivers, families, and friends' perception of the client's condition prevent them from completing activities and reaching their goals. This disability attitude can be considered a major criticism without proper family education. The criticism could deter clients from wanting to participate in our wellness program because it requires them to try new tasks and take risks that require support from others. As a program, we can work to improve this negative outlook because we are incorporating social support and services into the program to help increase quality of life. When looking at the environmental concerns and needs of our proposed program, we want to design a program with numerous outdoor recreational components, and because of our activities are so vastly different from one another, multiple locations will be ideal for this program. The locations we would like to utilize are Favor Dyke State Park, James Holland Memorial Park, and Fort Caroline Archery Club. Most of our physical events will take place at the state park for continuity and its versatile ability to fulfill the activity requirements for 5 of the 6 activities, including birdwatching, adaptive bicycling, adaptive fishing, and adaptive kayaking. We would like to use the courts at Memorial Park for adaptive rugby, and our archery activity will take place at the Archery Club, where participants will learn how to assemble and manipulate and shoot safely with instruction from a U.S. certified archer. After a major life event like a spinal cord injury, life for these individuals is turned upside down, making it difficult for them to be successful in everyday life, and this can be perpetuated when proper patient education is not provided. Sometimes, and unfortunately, quality care and patient education is not provided by healthcare professionals, therefore leaving our clients with little to no education regarding their condition. For this reason, our program will include educational components presented by guest speakers to educate our participants in regards to common symptoms, medical conditions, and physical limitations. Education is vital in improving the client's overall well-being and propelling them forward towards more independent lifestyle. The ecological concern that we must consider is the equipment and transportation needed in order to run our program. The equipment required for each of these programs is not one size fits all, so each individual will require specific modification based on their limitations. Therefore, we need to keep this in mind with each activity and the appropriate equipment needed, including upper extremity bikes, sport wheelchairs, adaptive fishing poles and paddles, wheelchair mounts for binoculars, kayaks, and various assisted technology for physical limitations. Transportation to and from the activity destination will be required, so a bus that is ADA accessible that can not only transport our participants and caregivers, but also the ability to store wheelchairs and equipment. The equipment and transportation are necessary for each activity to take place, which will inevitably become an economic challenge for us. Therefore, we need to consider the economic concerns, which may include grants and donations to our program to get it started, and additional grants to keep the program running every year.
Hi, my name is Anna Ahern, and I'm going to be talking about the collaborative aspect of this presentation. So, our program chose to collaborate with Brooks Rehab, Empower Spinal Cord Injury, and the Shepherd Center. Brooks Rehab is a program that was started in 2007 for those with physical and visual disabilities, and it's free of charge to participants, and it's also funded by Brooks Rehabilitation Parent Program. In addition, it consists of weekly sports, monthly special events, and monthly tournaments. Moving to the Empower Spinal Cord Injury program. This is funded by 3 physical therapists, specifically to spinal cord injuries. It consists of virtual and in-person programs throughout the year. Some of these are educational, and other of these are like wheelchair skills and wellness services. In addition, this is also a non-for-profit organization. And then moving to the Shepherd Center, this program was started in 1975. It is a specific rehab hospital that then moved into recreational therapy and different sports. In addition, it is not-for-profit again, and donations are accepted. In addition to sports, it also has educational and counseling services like disability laws and rights, benefits of wellness, and problem-solving techniques, just to name a few. Our program chose to collaborate with these because we think that it will help to provide more well-rounded program for our specific program. In addition, we want to work together with these other programs to help reach a larger population that could be underserved.
Hi, this is Seth again, and I'm going to be going over the multi-level approach community health model, and this is the model that we chose for our organization. The model itself has 5 phases, phase 1 being goal selection, phase 2 being intervention planning, phase 3 being program development, phase 4 being implementation preparations, and phase 5 being evaluation. Looking at phase 1, the goal itself is just the overall goal of the patient population that we want our organization to target. Here for the spinal cord injury patient population, we wanted to target a program that helped provide a fun recreational activity while also providing an educational component and a social aspect of an avenue for patients and participants to participate in. Looking at phase 2 for intervention planning, this phase itself is going into the details of the intervention planning that we're doing with our organization, and that here being a program that's offered 2 times a month with a recreational activity, initially talking about bird watching, archery, and adaptive biking, and providing educational programs for the different various components of wellness. Looking at phase 3, we're looking at program development, and here this is looking at all of the different areas that we need for this program to run, whether that be reaching out to the areas of collaboration, finding the land to use, funding, transportation, etc. When phase 4, we're looking at the implementation process, and here this is how we're going to implement our program, and we can see this over on the next couple of slides below with our schedule. And lastly, in phase 5, we have evaluation, where we're going to evaluate our program based on our participants' feedback, and in subsequent slides we will see that survey that participants will get to fill out.
This is Yildiz again. The recreational activities that our program will offer includes basketball, upper extremity bicycling, archery, kayaking, and bird watching. Social benefits include the opportunities to interact with other participants. Physical benefits offer enhanced cardiovascular fitness, enhanced hand-eye coordination, and improved upper body strength and core stability. Psychological benefits include mindfulness, relaxation, and the sense of freedom and independence. All activities and adaptive sports will allow individuals with SCIs to empower them to lead active, fulfilling lives and build strong connections with others, promoting a higher quality of life.
Hi, my name is Michelle Lynn, and I will be talking to you about what the event looks like. So here we have a sample of what the event schedule would look like. With our Stand Tall program, there's no skills required. The only requirement that we do ask of our participants is to pre-register. So our event does start at 9, but at 8 to 8:30 a.m. we do offer a carpooling transportation for our participants. And once everybody arrives at the event site, there will be 2 groups divided. There will be Group A and Group B. Group A will start with the special topic seminar for 90 minutes, and then Group B will start with the activities for 90 minutes. And then there will be a 15-minute break where everybody would switch, and then Group A will go into their activities while Group B goes into their special topic seminar. At the end of our event, there will be a special social event hour that includes food, debriefing time, and highlighting any empowering points and moments. And it also will allow our participants to socialize and reconnect with each other. Here is a sample of our upcoming events. So this includes what is coming up for the next 3 events, and includes archery, bird watching, and bicycling. And this would include on their in the email or mailed to them. And then here, shown on the slide, is 3 consecutive months of our activities. And the activities includes bird watching, archery, bicycling, fishing, kayaking, and quad rugby, which all these activities will have adaptive equipment provided.
Hello, this is Cullen again. In order to make our project objective, as well as to maintain client satisfaction, we will have a client satisfaction form at the end of each event. This form is going to assess the accessibility of transportation to and from the events, as well as any needs that may need to be addressed for individuals. We would also like to have a couple of questions based off of the topics of interest, as well as the activities that are provided. This allows us to be able to monitor how accessible each activity and how each topic can relate to our individual clients, as well as what we can do to improve them. We're doing this so that we can make sure that our program is more accessible to everybody, as well as to be able to individualize what needs are needing to be addressed throughout the community. So that concludes our presentation. We hope you enjoyed watching, and we hope that you are willing to support our business.